Welcome to our brand new class, DOH Changes Every LHCSA Must Implement in 2026. I want to give you guys the opportunity to just put your phones on silent, really get engaged with this training. We want to make it as interactive as possible. In the meantime, before we begin, we're going to wait for a couple more people to join us. So go ahead, grab a pen and paper. That way you can take notes. You are able to kind of take pictures of whatever you guys see. If you want any follow-up, you can feel free to email us at info@comp-agency, but we're going to give you some time to get ready, gather your pen, your paper, your notes, and we will begin in about 2 minutes. Okay, so let's go ahead, get ready, and start. Our agenda today looks like this. We are going to focus on quality assurance expectations, governing board expectations. We're going to review policies that were updated this year with the DAL reviews. Then we're going to go over DOH recommended changes for agencies based on the citations and all of the analytic data that we received in 2025. We're also going to remind you of emergency prep for the year. This is perfect because we had a few emergencies over the last couple of days, and what to expect in 2026. So let's jump into it. For quality assurance, a reminder, all of you should have 4 meetings at minimum for the year of 2025. Now, we go over quality assurance meeting minutes for a few of our members, and it's important to realize that each year you have to have 4 meetings. So now that we are in the year of 2026, you can go ahead and start having your quality assurance meetings depending on how you align it. And we'll go over kind of what the recommended alignment is for these meetings. Now, each of your meetings should contain at minimum an agency attendance sheet. So for example, you need to write who was present in these meetings, and they actually have to sign that they actually sat through these meetings. So for example, consumer representative is a mandatory person. So it should be someone who is not on the payroll of your agency. It can be a liaison of some sorts. It can actually be a consumer. It can be someone that represents the consumer, whether it's a friend or a family member, but it cannot be someone who works for your agency. You also need to have a medical professional as a part of your quality assurance team. Medical professional meaning RN or MD. Normally, or standard, is you guys should have a director of patient services, also known as a DPS, which should be an RN. That person can sit in on the meeting. Now, in each meeting, you have to review your policies and procedures. We're going to talk about all the changes that happened in 2025, which is very important for you guys to know and understand. But each meeting, we need to talk about your policies and what changes you made throughout the last quarter. Now, you also have to go over your complaint reviews. A lot of agencies forget about this. Even if you don't have any complaints, it's important to put no complaints received this quarter. Now, if you have complaints, it's important for you to review it for the quarter that just passed. That way, you can go ahead and align yourself with what needs to change, if anything, and you have to review the associated patient charts that are alongside those complaints. Then you have to go over your discharge record reviews that happened within the quarter that passed, as well as personnel and patient chart reviews as well. Now, this is what 90% of our agencies forget. Your quality assurance meeting minutes have to be submitted to your governing board. Now, it's important to actually put that sentence in your quality assurance meeting minutes. It should state something like, these quality assurance meeting minutes will be presented to our governing board on and whatever date. If you don't have a specific date as to when you're going to go over your governing board, you can put this quality assurance meeting minutes will be submitted to our governing board by quarter one or by quarter two. So that statement must be in your quality assurance meeting minutes. Now, DOH will cross-reference your quality assurance meeting minutes with your complaint log. The reason for this is they want to make sure that the complaints that you guys received, that you're actually reviewing it in your quality assurance meeting minutes. They want to make sure that your agency is reviewing those complaints, discussing the findings, resolving those complaints within the standard regulation timeframe, which is within 15 days as per regulation. So here's what the recommended guideline looks like for your quality assurance meeting minutes. Again, this is recommended. You don't have to do it this way if you feel like you have your own system, as long as you have 4 meetings a year. So the standard is meeting 1, you guys go over January through March. Meeting 2, you go over April through June's quarter. Meeting 3, July through September's quarter. And meeting 4, you go over October through December's quarter. A lot of agencies follow this way. Again, you don't have to, as long as you have 4 meetings and those 4 meetings go over everything that we just talked about. Your governing board. Now, the expectations for 2026 is that you have at least 1 meeting this year. If you haven't had one for 2025, do it ASAP. It's very important that you have a governing board meeting. In this governing board meeting, DOH looks for review or amending of your policy and procedures. Obviously, we're going to go over all of the changes that happened in 2025. We're going to go over all the policies. So your governing board for 2025 should indicate all of the policies that were reviewed and updated for the year. So we know quality assurance was 4 meetings a year. Governing board is 1 meeting per year. And you do not have to have a consumer or a consumer representative in your governing board meeting. The focus should be policy and procedure amendments at minimum. You can go ahead and add on other things during that meeting if you'd like, but DOH really looks for policy and procedure amendments and approvals, okay? So here are the updates that we're going to talk about today. Throughout 2025, there were so many, whether it's executive orders, alerts, updates. If you are a part of our email list, you will receive all of these updates as they come, which is a great part of being a part of our email list. But here are kind of a bird's eye view. Here are all of the updates that happened for 2025. First up was October 2024. We're going over this because it was actually brought to light in January of 2025. The cybersecurity update was released. DOH released a letter, a DAL, basically saying that you have to have safeguards to protect electronic health information. So that includes your EVVs, your online policies, anything that's online or digital. It can be patient records, personnel records, etc. So you should have a cybersecurity policy that requires staff training, how to secure your passwords, encryptions, everything involved in that. And as I mentioned before, the policy in place has to be in place for these things, whatever you have that's digital, okay? Now here is the DAL that was released on cybersecurity. As you see in the highlighted section, they said you have to implement cybersecurity policies and have a designed Chief Information Security Officer. So you have to have someone that is designated, not signed, designated or designed for the responsibility of providing annual reports on the program effectiveness, providing DOH with a policy if they visit and they would like to view it themselves. In January of 2025, DOH released the LGBTQ, or otherwise known as the Cultural Competency Requirement. Now, they released a DAL that basically went into great detail, stating that agencies must have training, whether it's a video, quiz, and policy, not even whether, it has to be all three actually, that your agency has to have a training on LGBTQ and any sort of statement which should be in your policy stating that you guys prohibit discrimination in care, hiring, and workplace practices. Now, we do have an LGBTQ training, and it is provided. I can put the link in an email and send it to all of our attendees if you guys are interested in this. But please know and understand that it is a requirement, and it is required every single year. So this should be an annual training for your caregivers. Now, caregivers means HHA, PCA. It also means nurses, social workers, dietitians, whatever you guys have on your team, whomever you have on your team, this is required. Now, there was also an emergency activation. The governor did activate emergency protocols in our, I think it was January, and then another one in June, another in December. So whenever there is an order released in regards to emergency protocols, it is important that you review these orders because some of them will discuss what you have to update in your policy. The one that was released in January of 2025 discussed that your policies need to be updated to reflect severe weather conditions and protocol to follow during an emergency activation, including your drill activations. So here is a visual screenshot of the order that was released. And this one was for major disasters, whether I think that one was for the snow. So it's important for you guys to remember you have to have emergency preparedness binders in place. Now, for those of you who are currently asking questions, yes, we do have someone responding to your questions on the back end. That way I can cleanly go through this very smoothly and have no interruptions. If we miss your question, we truly apologize, but don't worry, everyone is monitoring the questions and we will respond, whether it's via email or directly to you right now. So, in regards to emergency preparedness binders, yes, policies needs to be had, right? You need to definitely have a policy of your emergency preparedness. You need to have a roster and emergency drill section. Now, everyone is under the assumption that emergency policy can reside in the main binder and that's that. But no, DOH is requiring that you have an emergency preparedness binder. This should be a grab and go binder in case you lose your systems, things are not operating online, you have something physical that you can actually refer to. There was a time where Wi-Fi was down for one particular office and they could not access their patient roster, they could not access their manual, nothing. And actually, DOH showed up on site during that very same day. Not only were they cited, they were also in enforcement because there was an active emergency and they could not access any patient records. So please make sure to have an emergency preparedness binder that has your emergency policy, hard copy, emergency policy, emergency rosters, which includes your patient roster, which the patient roster needs to have a few things at minimum: emergency contacts, the TAL levels, the new ones that were released, the priority classification, etc. So please make sure that your policy has this in play. If it does not, you can send us an email at info@compagency.com. Now, your binder needs to also have a staff roster and a call down list, meaning in case of an emergency, who should they call first, second, third on that list, and so on and so forth. You need to also have a community partners list, a list of community partners in the area, local hospitals, local police department, fire department, local pharmacies, recreational centers that you guys can go to in case of an emergency. Then you need to also have your emergency drills in that binder. Now, we're going to talk about emergency drills in a minute, but just to give you an overview, emergency drill doesn't necessarily just mean a fire drill. It means whenever your emergency protocol is activated, what happens? This can mean severe weather conditions, food insecurities, which was big for 2025 as well. So you need to make sure that you have this in play for your emergency prep binder. Now, your emergency prep should look like this. When you talk about your drills, it needs to be according to emergencies. So, as you know, we had a recent snowstorm not too long ago, and you need to have everything in play for that snowstorm, meaning all of the rosters that we talked about, the patient, the staff, community partners. Then you also need to have protocols in place as to what happens when these emergencies occur. Now, you can have your emergency drills be like physical hard paper, or you actually write down what the drill is. For our members, we do have our emergency drill form online, which is super easy for you guys to fill out. Literally, all you do is put in the date of the drill, what type of drill, whether it's a mock drill, right, such as like a tester versus an active emergency. In this case, let's say snowstorm, for example, we're going to choose active emergency. And then we're actually going to choose snowstorm. Now, what I love about our emergency prep online form for our members is that we actually give you pre-populated statements to use so you can actually have a full report. There's no thinking involved in this. We totally understand how busy you guys get and how crazy it can get in case of an emergency. So we try to make this as simple as possible. If you are not one of our members, please make sure to have the specific items in play so that we know exactly what is happening, what your agency is doing in case of this emergency, and so on and so forth. Next up was February 2025. There was a CD pass transition. As we all know, you guys transitioned over to PPL for those of you who had those CD pass members and caregivers. So a DAL was released to outline the agency obligations and what you guys have to do in regards to this transition. Now, if you guys had any CD pass members, you definitely had to have some sort of policy in place to figure out how are they transitioning from standard CD pass into, for example, PCA or homemaker or housekeeper, and those roles that are actually on your agency license. How were you transitioning them? What was that process like? So you had to have a policy in place for that. Then in February, there was a measles health advisory alert. They did provide some education and health alert information on measles, and they reported that you need to have a policy that aligns with their guidance for infection control, isolation, and staff education during measles exposure incidents. This was major. As you can see in the highlighted section here, you guys also have access to all of these DALs on your dashboard as a part of this class. But they did state that you need to have policies that talk about being up to date on immunization, measles, mumps, the MMR vaccine, as well as I mentioned before, how to deal with this, isolated incidents, etc. In March of 2025, there was drug testing. Now, there was a drug testing educational item that was released by the DOH, and it basically went over what education needs to have in play for pre employment and ongoing drug screenings for your caregivers. Now, this is extremely important because it is a part of the regulation. They're stating that your policy needed to ensure compliance with those regulations of maintaining workplace and patient safety when it comes to drug testing. So it looked like this. It was a 2025 health advisory in regards to the synthetic cannabinoid K2 for New York City. And along with that, they re-released the cannabis and workplace protocols from the Department of Labor. Now, I want you guys to also note that it is important for you guys to do pre-employment drug testing and ongoing habituation assessments. That is required by law. Again, pre-employment drug testing, which is within 12 months of hire, and ongoing, meaning annual drug attestations for your staff. Now, according to the Department of Aging, it is required for you guys to do the drug testing. It is also a regulation. Now, that is a part of, let me show you. That is a part of the compliance 16.1 requirement that is in compliance with the New York State Department of Health requirement for all employees to be tested. As you can see here in the highlighted section, you have to have consistent guidelines, meaning your policies have to be in order, and you have to test for drugs. Now, if an applicant tests positive, they should not be hired, right? And unless he or she is taking a drug under the medical professional's orders. In regards to Standard 16, this is under the worker health and medical screening. It is extremely important that you guys are aware of the requirements and the ongoing requirements for pre-employment and annual recertifications. For dual certified aides, DOH was releasing a DAL that had guidance for aides who were dual certified. Dual certified meaning they were both an HHA and a PCA, and you had to have a policy in place ensuring separation of duties and conflict-free services. So your policy definitely needs to clarify what are the operational standards for your caregivers who have both an HHA and PCA certificate. Now, this DAL highlighted three major things. One, PCA certificates do not lapse, they do not expire. Okay. Now, this is for aides who completed their PCA certificate before and after 2009 who are listed in the home care registry. For HHAs, certificates acquired before 2009, right? This is extremely important, and the aide is listed in the home care registry. Their certificates are valid if they have completed an approved training program. Now, they have to have worked consecutively. If you have an aide who did not work for 24 months, 24 consecutive months, they are no longer an HHA. That means their certificate has expired. Now, if you have an aide who has not worked for at least 24 consecutive months, they need to go back and take the training in an HHA approved training facility. That is a requirement, okay? They have to participate in an approved HHA training program in order to have a renewal certificate and actually be placed with a patient. In May 2025, DOH released a DAL about MOLST. Now, for those of you who are not familiar with MOLST, it's Medical Orders for Life-Sustaining Treatment, MOLST. So they released a letter just providing clarification stating that you must have a policy that establishes procedures for this actual process. Now, it's for seriously ill patients, and it also ensures the care that your providers are supposed to follow and instructions that they're supposed to follow, whether it's about feeding, hydration, CPR, intubation, such as small items like that. Now, you need to also make sure that your policy states this as well. It's important for you guys to abide by the patient's wishes for end-of-life care. In June 2025, they released a second MOLST DAL that went over just a few clarifications from MOLST 1. So make sure that you have both of them. As you see here, this is an example of one of them. It was going over different changes that were in relation to like the DNRs, the DNIs, things like that. But you do have access to this DAL on your dashboard for further review. Licensure amendments were extremely important for August 2025 because according to the DOH, there was a large uptick in agencies wanting to make changes to their license, whether it was adding an additional location, adding additional roles and services to their license, such as they wanted to have a dietitian added, or they wanted to have a homekeeper, housekeeper added. So the DOH released this DAL on how to kind of change that process of asking for these changes for your license. So now these changes had to go through a different process. It wasn't as simple as it was before. So specifically licensure agencies who would like to, whether it's delete a service, add a county, here are A through G, here are the specific amendments that were included and the new process for doing that in terms of updating your license. In July of 2025, there was a 64% increase in citations for agencies that had no larceny policy. Now, I know in the regulations it doesn't say anything about larceny. However, it's important for you guys to understand that the larceny situation falls under specific regulations, and we're going to go over that in detail. Before we do that, it's important for you guys to understand that policies should protect your patient's property by requiring your staff to be educated, monitored, and reported through certain channels. There needs to be some sort of workflow or process on larceny. And your policy also needs to establish what you guys do when you do come across a larceny case. What are the procedures for suspected theft? How do you safeguard both the patients and the agency at the same time? So that is a requirement. So we reached out to DOH to give them an understanding of how our agencies and our members were a little confused, stating that this was not actually in the regulation. And they responded with, yes, it is. It is in the regulation. It's under violation of patient rights. It's also under personnel standards and governing authority. And they gave us this kind of breakdown of how it does get incorporated into the regulation, even though it doesn't say verbatim larceny is a part of the regulation. It falls under these subcategories. Oxygen safety was another one. There was a 70% increase in citations for home care agencies with no oxygen safety policy. So DOH citations reveals that there are agencies out there who did not have these policies in place, and they explain that your agency is responsible for having a policy for safe oxygen use in patient homes. And we also reached out to them for clarification, and they provided this. Yes, oxygen safety does fall under the regulation of Patient Service Policy 766.2 for equipment safety, and also medical orders for any patient that has orders of oxygen on their medical order. It is extremely important for agencies to have this. So we do suggest that you go through your list of patients. If there is any patient that has oxygen, this is extremely important for you to include in your policy and procedure manual. Now, statistical reports, everyone was very nervous about this. When they released this in 2025 in September, they did state that we are doing a 2024 statistical report, and the deadline to complete this is December 31st, 2025. As you know, there should be a policy with clear guidelines for you to complete the report with software links provided, right? So you need to go over how to complete the report, why it's important, what's included in the report. It is mandatory for you to have this in your policy, and they go over who is responsible for it, when the deadline is, etc. Just so that you guys know, if you do not complete your statistical report, you will be subjected to fines. There is a monthly fine of $500 a month that the DOH imposes, and you can be barred from operation. Even though this is very rare, they are going after licenses. DOH, they do demand that you have completed the registration for statistical report. If not, they do state that you're not allowed to operate. If you do not register for the statistical report, there have been rare cases that the DOH had to revoke an agency's license, mainly because they just weren't staying on top of their paperwork and the requirements by law. Okay, so please do not get caught. Make sure that you have at least registered for your statistical report and completed it whenever you get this notice. One thing that a lot of agencies actually didn't know until it was at the very last minute, we do have a percentage of members who only work with MacBooks or Apple items, right? Apple laptop, desktop, etc. Note that you cannot utilize the statistical report gateway through the healthcare financial data gateway if you have an Apple computer. Just know that it has to be through a Windows computer. October 2025, there were HCS changes, Health Commerce System changes. And yes, it ensured agencies maintained and updated their HCS accounts. It went over what are the newest requirements for 2025 for the Health Commerce System and Health Commerce System roles. So all of our agencies had to update their Health Commerce System policies because they had to include what the updated requirements were for these specific roles. So as mentioned here in the DAL, to ensure compliance, you guys were expected to establish and maintain the policies and procedures as it's related to the roles. And then it went over exactly what those roles are and what the requirements needed to be for your new policy. Right, so that was 2025. But since we're dipping into 2026, let's talk about the newest changes that happened. There was an EISEP charting document that was released, and it was for non medical programs. So, any agencies that had patients that were non medical, this could mean housekeeper, homekeepers, right? Anyone that's non medical, right? This does not include HHA and PCA, but it's for agencies with adults that were aged 60 and over who were not Medicaid eligible. So this does mean like your private pay patients, and focused on supportive services to help them just to remain safely in their home. DOH released some guidance on this, and they explained that most LHCSAs are actually not directly EISEP providers. Now, it's very important for you to remember and understand that there are some LHCSAs that are impacted by this because they have contracts with the Department of Aging or a Department of Aging agency. Or if you have private pay patients that have services that are non medical, this does fall under your category. Now, there was a clear distinction in that notice that basically explained that agencies must have or must differentiate their EISEP patients along with their Medicaid patients and private pay services. What does this mean? It means you need to have a roster for every different type of service that you are providing. You should have a roster of solely private pay patients. You should have a roster of solely CHA patients. If you want to have one roster with all of your patients, at least categorize them so that when DOH shows up, you can give them the roster that's better suited for what they're looking for. So most of the time, DOH will show up and they will not ask for a CHA roster. They'll just say, just give me your LHCSAs that or patients that are not in a CHA, or just give me a list of your private pay patients. So it's important to have a roster that can differentiate your different patients and the different services that they receive. And here is the EISEP notice that was released, and it stands for Expanded In-Home Services for the Elderly. Just make sure that you remember and understand that, okay? Now let's talk about what to expect in 2026. Now, what 2025 showed us is that waiting for DOH to settle down is no longer a strategy. 14 or more updates in a single year tells us that policy changes are now driven by just real-time survey activity. When DOH shows up, that's when we kind of notice that there are changes coming down the pipeline, not annual plans. That means agencies are being evaluated against guidance that may not have existed at the beginning of the year. In 2026, the updates will continue and agencies will still be held accountable, whether they're tracking them or not. Just remember that, okay? Now, this is why compliance today is not about memorizing regulations. It's about having a way to just stay current as changes happen. For those of you who are already members, this entire presentation should feel very familiar. As a member, you already have access to all of the policies that were updated throughout 2025. You have the Department of Health releases. As the DOH releases new stuff, you guys get the clarification, the enforcement updates, etc. And those policies will continue to be updated for you and automatically placed on your dashboard. You don't have to track DALs. As a member, you don't have to rewrite any policies, and you don't have to guess what surveyors are enforcing because we do provide that in the membership for our members. In addition to the policies, you also have ongoing education. There's audit prep trainings on your dashboard, step-by-step guidance inside the dashboard that walks you through how to remain compliant. So that's great. We want you to continue utilizing these benefits because the goal of the membership is just simple: to help you remain compliant without the constant stress of staying up to date on regulations or policies on your own. Okay, so just know that for our members, nothing changes except that 2026 is already being handled for you. For our non-members, now, if you're not currently a member, I want to be very transparent with you. Everything that we reviewed today is what agencies are responsible for staying on top of year after year. As long as you're licensed under Article 36, this is important. You can absolutely leave this class and manage this on your own, tracking the Dear Administrator, the DAL letters, updating the policies on your own, monitoring enforcement trends, monitoring and preparing for audits as they come. You can definitely do that solo, or you can choose not to carry that burden alone. So we have our monthly LHCSA membership. This exists for agencies that don't want to worry about whether their policies are current, whether something changed that they missed, or whether they're just prepared for an upcoming survey. Inside of our membership, we write and update the policies for you as DOH releases the guidance. Those policies are automatically added to your dashboard, no requests, no delays. You also receive just ongoing education, audit prep classes, walkthroughs that show you how to remain compliant and how to prepare for DOH surveys with confidence. So, the mission of this membership, again, as I stated, is very simple. It's to keep your agency compliant, organized, and prepared without you having to stress about the policies or the regulatory changes. If this sounds like the type of support that your agency needs, you'll see a button pop up to join the membership. You can do that. You can enroll today, and everything that we discussed becomes something that you no longer have to manage alone. Okay? Okay, so let's go ahead and answer some of your questions. I know, Jake, that were you respond? Okay, good. So you've most of the questions. If there's anything that we missed, as I mentioned before, feel free to email us at info@compagency.com. But let me go ahead and see if I can scroll through. There's actually a lot of questions. Let me see what I can do. Okay, first question. In regards to the emergency and preparedness binder, what are the requirements for an emergency drill in the case of the snowstorm that passed? Okay, so in regards to the snowstorm that passed, you guys should have had a drill, sort of some sort of documentation that went over what you did as an agency to prepare for this emergency and what you did to help your patients and your caregivers prepare. So, did you make phone calls to your patients to ensure that they were good after the snowstorm passed? Or did you make phone calls to your patients before the storm to ensure that they had enough food and shelter? Did you check your rosters to ensure that they are up to date? Meaning, we had an agency that had a recent emergency and realized that half of their roster were of discharged patients. So, did you make sure that your roster was updated with the most updated telephone numbers for your patients and their emergency contacts, the most updated TAL levels? There was an instance where an agency was in the middle of an emergency and they had their TAL level as someone who is not bedbound, but able to walk and actually travel in case of an emergency. And it turns out that patient was actually bedbound. So, are these things updated? What did you do? Right? So, give yourself the credit for when you're preparing for an emergency and making these phone calls to your patients and your caregivers. All of that needs to be in that drill document. Okay. Is a membership needed if I attended this class? That's a great question. The honest answer is yes, because this class gives you awareness, but the membership gives you continuity. For example, today you learned about what changed in 2025 and what's being enforced now, but we only did that up until January 2026, right? There are changes that's going to happen afterwards that will be in our following class for the next year. So the membership is what keeps you covered when the next change happens without you having to track, interpret, or rewrite anything yourself. What if I'm a small agency? Is this membership even worth it? Absolutely. I totally understand that smaller agencies have less needs and smaller budget, but the Department of Health does not scale compliance expectations based on your agency's size, right? An agency with 20 patients is still held to the same Article 36 standards as an agency with 2,000 patients. The membership is most valuable for smaller agencies because it removes the burden of having to monitor these changes from DOH without a full compliance department. Do you guys provide policy update services? Yes, we do provide policy update services. We do customized services. We do one-time policy updates. In the event that, let's say, for example, the DOH shows up at your door, we have emergency policy updates as well, where you can send us an email and we have a consultant that will get back to you within less than 24 hours of any changes that you have to make if you're in the middle of an audit. What happens when DOH releases a new DAL letter? When DOH releases a new letter, we review it. We interpret how it impacts the Article 36 agencies, which are you guys, the home care agencies, and we update or create the necessary policies that are aligned with that DAL. So that is your responsibility as an agency, but with our members, we do it for them. And those updated policies are then automatically placed on their dashboard. So they don't have to request it, they don't have to figure out what it applies to. It's like simple. You're simply kept current. That's it. But your responsibility is, yes, you have to review it. You would have to create those policies and the workflow that is involved with those policies. What if I already have policies? Are they just old? Do they have to be updated? That's actually the most common situation that we see. A lot of agencies are under the assumption that they purchase that policy and procedure manual and it's good forever, but that's not the case. As we saw, there's been about 14 or so updates or changes for 2025. So most agencies don't have missing policies, they have outdated ones, right? And I always suggest that during your quality assurance meeting minutes, you guys sit down and you go over the policies every quarter to see what changes were made in that particular quarter. This membership ensures that your policies don't quietly fall behind as DOH guidance evolves throughout the year. It's not about starting over, it's more so about just staying aligned. Do you guys provide actual compliance and consulting support for home care agencies? Yes. So our membership does have tiers. We have our first tier, which is solely policy and procedure review and updates and dashboard cleaning. And then we have our second tier, which is both the policies and consulting, where you have someone available 24/7 to provide any sort of consulting questions, to answer any questions, to provide any sort of knowledge and guidance for you. I think Jake answered all of the other questions. Thank you very much. I do hope that you guys gained something from this, that there was some sort of insight for you in regards to all of the DAL reviews and all of the changes that happened in 2025. I did my quality assurance meeting minutes for 2025. I noticed that we only had 3 meetings. However, we covered all of 2024 into 2025. Is that acceptable? No, that is not acceptable. As per regulations, you need to have a minimum of 4 quality assurance meeting minutes. For cybersecurity, we only have EVV. All of our records are hard copy patient and hard copy personnel. Do we need to have a cybersecurity policy? Yes, you do. Absolutely. Your EVV is digital. Therefore, you absolutely need a cybersecurity policy. Something that at least states, like, let's say someone hacks your EVV, what's the policy and procedure for that? How are you keeping it secure? How are passwords being kept secure for that? For the LGBTQ training, is it really required? Is it an actual regulation? Yes. So they let that out, I think it was January of 2025. So you have to have a video training. You also have to have a policy on LGBTQ or cultural competency. And with every training for in service, it needs to have a quiz, it needs to have a certificate. So this should be embedded into your current in service right now. If you guys don't have in service, if that is a service that we provide to build a platform for you, if you already have an in service platform or workflow for your aides or your caregivers in general, you do have to incorporate the LGBTQ. Okay, so I think that was it. We have a few questions, as Jake said, was answered already. Again, if I missed it, I truly apologize. We tried to keep this training in under 45 minutes, and we're pretty much at time right now. So if I did miss any of your questions, please feel free to email info@compagency.com. It is pinned in the chat section below. And we do look forward to having additional trainings for you guys. If there's a specific training that you would like to have, again, shoot us an email and we will go ahead and have that for our members as well. If you're interested in joining the membership, the button is below for you guys to do that as well. I hope you have a great and safe rest of your day, and we look forward to working with each and every one of you in the future. Have a good one.